Thank you, Lindsay. Good afternoon or good morning if you live on the West Coast like I do. It is a very, very good morning. Nice and sunny finally. So happy spring. So good morning, very much like Lindsay mentioned. My name is Ryan Dinwiddie. So I'm the Chief Solution Architect, and I'm also a ServiceNow Certified Master Architect here with Beyond 20. I've spent the last decade or so working specifically with ServiceNow, and also kind of working a lot in the last couple of years with like the kind of like healthcare life sciences area. So quite a few pharmaceutical customers, some hospitals, some clinics, and then we're going to kind of bring that expertise in a little bit throughout today. But up next is Mr. David.
Hi, it's great to be here today. I'm David Crouch. I'm a senior advisor at Beyond 20, coming to you today from also sunny Baltimore, Maryland. And prior to coming to Beyond 20, I spent about 20 years at Johns Hopkins doing a number of things in the service management space, including being on the customer side of a ServiceNow implementation. And we also have with us today, Joe.
Thank you, David. Hi, everyone. Thanks for joining today. I am Joe Aranzullo, Director of Service Delivery here at Beyond 20. I started my ServiceNow journey many years ago on the client side, similar to David. From there, I moved into the consulting space and have been working with the platform for the last 10 years. During that time, I worked with a lot of clients in the healthcare industry, similar to Ryan, hospitals, medical device manufacturers, insurance companies. And today we're going to take a deeper dive into our collective experience working in the space. So today, David, Ryan, and I are going to talk through the major phases of an implementation in an organization, the keys to success with the hard lessons we've learned along the way. We'll take a high-level look at what ServiceNow brings to the healthcare and life sciences environment. We'll discuss the expansion of service catalog taxonomy as it relates to healthcare technology management. And then we'll wrap up talking about organizational change and developing metrics to ensure long-term return on investment. Getting right into it with our current state, David, with your experience at Johns Hopkins, what in your eyes is the current landscape? What are some of the common challenges you're facing?
Well, I think there are two really big things that we need to talk about. The first is really the current financial landscape, and I probably don't need to tell the folks who are here joining the webinar about the financial situation in the healthcare sector right now. I will anyway, but all of us know that the pandemic has had a huge impact on every industry. Healthcare is no exception. If you just look at some of the stats here, during the height of the pandemic, healthcare institutions have lost about $200 billion in revenue. Elective procedures are being canceled during this time. People are sick, but they're not coming into the hospital or to the doctor's office unless they absolutely have to. If you look at margins right now, depending on the source that you read, they're down about 40% compared to this time pre-pandemic. So that's fairly significant. At the same time, expenses are up, right? $150 billion across the board in increased expenses, compared to pre-pandemic. And then just to add a little bit of sting to this, any of that government funding that we got during COVID, is going away, right? So end of the PHE funding, if you just look at Medicaid alone, about a 6.2% of our funding is going away. I have a friend who's a chief operating officer for a local hospital, and pretty much overnight he has to find some way of coming up with somewhere around $350 or so million to replace this lost revenue. So not fun times from a financial perspective. We also have, some uncertainty around the banking sector, right? So, we all know about the recent troubles with Silicon Valley Bank. Most of my friends in the healthcare sector say that they don't believe that, for a lot of hospitals at least, that this will have a major impact on finances in the short term. It might set innovation in the life sciences and in healthcare back for a good number of years, but from a financial perspective, probably not a big impact. But we've seen some other banks sort of stumble recently. So this is a big question mark in my mind. This is something to keep an eye on. But it's not just the financial landscape that we have to think about. We also have to think about, the broader organizational landscape. And when we look at that, I remember just a few years ago, it seems like just a few years ago, every healthcare organization, every hospital out there was thinking about implementing an EHR system, electronic health record system. And that was kind of the bright and shiny new thing, the difficult thing to do. And at this point, about 96% or so of hospitals in the US and then also physicians' offices have implemented at least some sort of basic EHR system. So it's not necessarily the newest thing anymore for healthcare, but at the same time, organizations haven't gotten the full benefits of those EHR systems. And just a couple of examples of that, just think from the patient perspective. As a patient, I should be able really to go from the hospital to my primary care doctor's office to another hospital anywhere in the United States, really, and be able to have my medical records follow me, regardless of the EHR system they're using, and especially if they're using the same system. So if they're using Epic, they should be able to have that, for example, in a system with a different provider. But the reality is that's not true across the board. It is in some cases, but I've still run into this even just a few weeks ago. Beyond just integration and interoperability with other EHR systems and other providers, just basic lack of integration between EHR systems and other IT tools. So I think we have it to some extent, but it could go so much farther than it's going now. Taking a step back, what about the providers themselves, the people side of things? People are burnt out. Again, talking to some of my friends in the industry now, some of the executives are saying that, look, people are leaving. People are retiring if they can. They're going to other places to work. They're getting out of the field. And what does that mean for them? That means that, well, now I have to replace them with a temporary employee and probably paying significantly more money per hour for that person. So we need to find some sort of way of we might not be able to totally solve it, but of making that frustration a little bit less. From an IT perspective, CIOs are telling me, look, we don't just want to be the order taker, but our CEOs, some of the other executives within the hospital are seeing IT as the order taker. Give me what I need, but not necessarily seeing IT as really driving strategy, really, at best being a partner with the business, but not necessarily right there in the boardroom driving the strategy. And then a really specific area that we've seen pain points in recently is difficulty managing assets beyond IT, so non-IT assets, things like durable medical equipment, medical devices, some of your larger pieces of kind of fixed assets, MRIs and things like that. But this plays into managing cost, it plays into patient satisfaction, it plays into dealing with risk. And even though organizations have robust EHR systems, they're not necessarily leveraging that or doing anything to do a better job of managing these non-IT assets. So that has become a really pointed area of pain for organizations. Now, there are others that we can go into, but I guess just looking at these alone, I'd like to introduce Ryan again to take us through some of the ways that ServiceNow can help us out to make these better.
Thanks, David. So David has just spent the last couple of minutes bringing up some very real challenges and challenges that hopefully are across the board. But it's important to think about too, once we have these challenges, what are we going to do about it? And I think that's one of the neat things I really like about kind of the newer offering from ServiceNow when we talk about like the digital health platform. So I'm going to kind of skip over this base layer for a little bit. So we've got the same great platform that a lot of people use today, regardless of industry. So they're all working in like the IT workflows, the customer workflows areas. But one of the things I'm really excited about with this is taking what ServiceNow has done is taking that kind of like healthcare and life sciences model and adding kind of a service management flair to it and building it on top of the existing ServiceNow platform. So we'll dive into these a little more in depth a little bit later on today. But this is one of the things that I think is absolutely amazing is we've seen just how fast non-healthcare or organizations in other verticals will, adopt with ServiceNow and run with ServiceNow. And then we take the kind of like expansiveness and amazing platform and start to apply that to kind of the healthcare industry. And then also on top of that too, there's a few purpose-built applications from ServiceNow existing within kind of this healthcare and life sciences model. So this is not the first time we've seen ServiceNow respond very quickly to changes in the marketplace. If we think back to when we were starting to do when we saw the first initial tail off of COVID and some of the return to work applications, we saw the return to work applications from ServiceNow developed very rapidly, deployed very rapidly, and I've even deployed them myself for a healthcare organization on the West Coast. So there are specific applications that have been pre-built, but there is also that ability in the platform for organizations to develop their own custom applications using some of that like healthcare life sciences model, the data. We're going to talk about data quite a bit today. Okay, so we've got kind of the challenges. We've got where we think or how we think we can address those challenges. So let's talk about kind of the implementation best practices here. So one of the first things that we want to do is start at the end. This seems kind of like a silly place. Where do we start? Let's start at the end. But the idea being that, Joe and David and I have learned from all the implementations that we've done that, the best implementations are those that have a clear end goal. And the clear end goal in this example might just be that maybe I want to be the best healthcare, offer the best healthcare experience in the Northeast. Maybe I want to have like the lowest visited returns. Maybe I want to have the highest patient satisfaction. What is that kind of like overarching goal? Once we have that, we can develop our guiding principles. These are going to be our guardrails and kind of our North Star for that implementation. And these guiding principles can help us keep in check scope, customization, configuration. Where are we with an alignment of our end goal? And we'll talk about that a little bit more later on as well. The next thing that Joe and I are going to dive into a little bit is bringing in our centers of excellence. So if we're talking about using ServiceNow to change the way that organizations interact with their employees and patients, that is something that's going to be spread across the organization. So we need to kind of spread out and, specialize that work a little bit. So we're going to involve, centers of excellence across the organization. We know where we're going, but if we don't know how we're going to get there, we might not take the most effective route. So we're going to dive into an example roadmap, but this is a really good way, even if it's just, kind of part of our end goal and guiding principles, we roughly need to know how we're going to get to where we want to be. And one of the things that I think Joe and I have felt a lot is once the word is out, everybody is going to want in, for lack of a better term. So that's kind of one of those things that we've learned, one of those lessons learned from a long time ago is we need to make sure that this is something that is repeatable, it is sustainable, because this doesn't necessarily show it, but the cycle continues back to what's our end goal when more parts of the organization may want in or may have use cases for ServiceNow.
Yeah, Ryan. And what I've seen is that these pillars can be overlooked. Attention to these principles can be discounted. I mean, it might not be out of malice, but maybe it's a time crunch or a resource crunch. But what's really important to keep in mind is how impactful the implementation is. It's not only a big time and financial investment, but it's also very impactful to your customers, which are nurses, clinicians, and patients. So we'll speak more about keys to success later, but this is certainly one of those keys.
Thanks, Joe. So let's dive into our guiding principles. So this is one of those areas that Joe and I want to dig into a little bit more, just because, with the power of ServiceNow, we really want to think about and be mindful with where we're headed and how we manage it. So when we think about guiding principles, here's just some good recommendations and some guiding principles that kind of we've netted out across all of our implementation experience, but thinking about that experience first. We want to make sure that we are driving change and changing that status quo. So one of the best things a consultant can hear is this is the way we've always done it, because that's an immediate dig in question. Why do you do it this way? Let's dig in and talk about that. One of the other things, especially when we talk about cost and return on investment, is making sure that with our roadmap is that we're getting a quick path to value. So if we have an amazing system that takes years to implement, that doesn't necessarily do a lot of good in the short term to the organization, to the patients, to the clinicians. And as with everything in ServiceNow, we want to go out of box first. So we've got some stories a little bit later on. I've got a healthcare organization I worked with on the West Coast here that did not go out of box first, and it kind of, spoiler alert, did not end well. So we'll talk about that and wanting to make sure that that's always kind of in the forefront of people's mind. But one of the things holding up this guiding principle is going to be that architecture. So wanting to make sure that we are connecting to enterprise architecture teams within the healthcare organizations with IT. We want to reduce and reuse. We want to make sure that we're using shared architecture and kind of like cutting costs and cutting waste.
Yeah, when it comes to design, ServiceNow gives a great foundation to build a functional and intuitive UI. Using what's already there, you can create a great employee experience and even add in some automation or level 0 support options for those in the field. When it comes to governance, there are a lot of options when it comes to implementing ServiceNow. It's very easy for your eyes to become bigger than your stomach, your budget, or your timeline. It's important to keep in mind that iterative success always beats delayed perfection, and having more digestible incremental changes will not only help OCM, but they'll enhance the employee experience and help increase the maintained platform adoption.
And one of the pillars that I would argue is probably more so significant than the others is going to be data. If I had a theme for today, it would probably be data. And what's one of the things that we're going to talk about the most within kind of the healthcare model within ServiceNow is so much data is going to be required to provide that holistic, excellent experience. And then there's always that question of how do we get that data in? Where does it come from? How do we qualify it? There's some additional things that we're going to talk about a little bit later on today, but data is one of those things that that is going to be paramount to the success of any like implementation and transformation. So on the IT side, ServiceNow has worked really hard to develop the common services data model. And that's going to be a great benefit and adoption and something that we really encourage clients to look at and work with. There's also, with the addition of healthcare, there is the healthcare life sciences data model. We'll be talking about that a little bit later on today as well. But it really comes down to making sure that we have the correct data in place to meet our end goals, keeping our end goals in mind. Okay, so one of the things I want to talk about, let's have a quick example of like what healthcare data management looks like and where some of our governance comes into play. So let's kind of start with our as we've been affectionately calling it internally, our wheel. So when we've got our wheel of people, for lack of a better term, with some air quotes there that we may be interacting with, whether these are people, whether these organizations. Any of these personas could potentially be putting in a case, or again, putting case in air quotes there, because it could be like something's broken, I need something, all the different types of request and intake that's going to happen. It could be from anyone within this area. So that's where we kind of start to see the HCLS model have a lot of that supporting data. Because that's also where we're going to have the automation engine. And that automation engine pre-built within ServiceNow that's already been very well proven on the IT side to be able to help us organize, and interact with other systems of record and other tools. And we see those systems of record here, but that's going to allow for the fulfillment and automation of incoming requests. We can leverage connections to existing applications within the environment like DocuSign or Adobe Sign. Connect it to clinical data or clinical systems, automate workflows like password reset, have interactions like pre-visit management, or even any of that software distribution. So having that facilitate that engagement layer for patients, for employees, for the general public, for whoever needs access.
Yeah, you really hit the nail on the head, Ryan. My big takeaway is that ServiceNow is not the replacement for all the systems you have today. ServiceNow is that engagement layer, while your systems of record continue to be just that. This is important to note, as when your customers have a question or need help, need to check the status of something, they only need to go to one place to have access to everything they need.
One of the other big things that that I wanted to bring in from the how it's done is the centers of excellence. So ServiceNow is an investment in your organization, and it needs to be treated as such. So we've learned that ServiceNow is so configurable that it benefits immensely from guardrails like design standards and practices. So that's one of those kind of centers of excellence that we encourage. We also encourage lightweight governance along with that kind of good design standards and good practices. It's really nice to be able to see that, and we see that for long-term platform health and then continued return on investment for the platform. Another kind of pillar of our centers of excellence is going to be continual improvement processes. So this is not a set it and forget it. This is going to be an always, how can we do it better? And this is going to be part of an evolutionary process of how do we make things better for patients, for clinicians. We also need to make sure that these are available 24/7, 365 until the end of time. So we need to have that stable, monitored environments always available. And we also need to have a strong support team, that strong team with solid knowledge to be able to support, immediately dive in, address any issues that may arise, and also respond to anything, and then develop, in accordance with those design standards and good practices. Okay, so now that we've kind of talked about centers of excellence and some of the guiding principles, let's kind of dive into a little bit more of a meatier topic around some of the things that we have learned over the past. So I'm going to turn it over to David.
Yeah, thanks, Ryan. I mean, when you've done this once or twice before, you do a lot of things well, but you also get beaten up a little bit, and the key here is to learn from that and to do it better the next time. And for me in particular as well, I've been on the customer side of this. So being in a healthcare environment, you get to know it a bit. One of my big takeaways is that I have plenty of doctor friends, and I had a lot of colleagues when I worked at Johns Hopkins who were doctors and nurses and other clinicians. And the doctors are smart to be sure, but they're generally not speaking technologists. They may think they are, and you probably know one or two of them like this, but they're not technologists. They need to spend time doing what they do best, which is normally some combination of doing patient care, maybe meeting with patients in clinic, maybe seeing them in the OR, research, etc. But we need to give them time to do their work and not to mess around or worry about how to navigate IT systems. So our systems, when we implement them, frankly, they just need to work. They need to be as easy as possible to navigate, as few clicks as possible. So we give our clinicians time to do what they do best, which is patient care. Now, also at the same time, we recognize that over time, demand will change. What our customers, what our in-house clinicians, and what our patients need will change over time. And so we want to be really conscious of minimizing technical debt, even eliminating technical debt. And what do I mean by that? We want to design systems in a way that we don't have to reinvent the wheel. We want to make sure that as we adapt, as we change our systems, that we make sure that it's scalable, that we can change it relatively easily, and that it still remains reliable. In addition to that, I know Joe and I have both certainly dealt with privacy issues in implementing ServiceNow.
Yeah, we certainly have, David. I remember early in my consulting career, I was working with a healthcare company as part of a staff augmentation team. And one of the tasks my team was responsible for was protecting patient privacy within the ServiceNow platform. What that meant was we would manually search through records or use a script or a custom report to find exposed sensitive data, like, hi, my social is this and my leg hurts. Now, sometimes the customer would find those before we did and report them to us. When we did find an offending record, we would have to go in and manually update that record to remove any sensitive data. On top of that, we would also be updating any referential data or record history as well. Now, this was a very long time ago, and the platform has come a long way since then. And now there are features like data anonymization, data privacy, that can be configured to look for this data automatically and either obfuscate it in a production environment or anonymize it in a lower environment for use in testing and configuring the platform. If your goal is data compliance, there's also a range of encryption options like edge encryption, as well as column level encryption to keep your data your data.
It's always a good call out, Joe. So earlier today, I mentioned that one of the more memorable experiences I have working with a hospital system is they went live with ServiceNow quite a while ago. They were a very early adopter, and they didn't have a lot of the guiding principles and guardrails that we're encouraging today. And they're one of the reasons that I talk about having those guardrails and the guiding principles, because they went a little too far with their customizations, and their upgrades were taking like 2 to 3+ months. And for those that currently have ServiceNow and work with ServiceNow, they know that that's just way too long for a ServiceNow upgrade. So their upgrades were taking 2 to 3 times longer. So after a couple of years of struggling with their upgrades, the decision was made to kind of roll back to out of box and re-implement and stay back as close to out of box as possible. And one of the kind of like, after consulting with them and digging to understand why, one of the things that came to light that always stayed with me was they didn't really have a roadmap for the platform. So because of this, a lot of their implementations were reactionary. So they would get an ask, they would get an issue that would come up, they would just move forward, they would address the issue. There wasn't a lot of that kind of like higher level thought about where does this fit within our timeline, where does this fit within the applications that we are using within the landscape. It was just, let's respond, let's get it in. And without having that kind of like roadmap, they weren't necessarily able to figure out where things fit within the organization, and they were left with a very convoluted way to get to their end goal, which they initially did not get to their end goal until they had their re-implementation. So earlier this week, or actually last week, Joe and I worked up just kind of a quick example of a roadmap. So this is just kind of what something might look like for implementing ServiceNow within an organization, but also having some of that healthcare life sciences data model. So I'm going to pull out my little handy dandy laser pointer here. One of the things that I want to note is when we talk about the two datas, and I told you data would be kind of the drum I was going to be beating for the webinar today. Data is really where we start both of the implementations. So we don't start putting any like IT service management, any of those other areas. We start the data work first. And that's going to be in alignment with our recommendations, but we're also going to be starting that organizational change management and that continual improvement process at the beginning. For us, that runs the entire life cycle of the implementation. From there, we're looking at some of those healthcare lifecycle apps. So we're looking at some of those client or patient or clinician interactions around mobile interfaces, any of that AI machine learning that ServiceNow has that's just out of the box, that's great. Maybe some chat, some virtual agent, potentially looking at an upgrade if we're looking at spreading this out over a year for an implementation. One of the final things that I want to mention too, before I turn it over to David, is service catalog. So I think David's got a very unique perspective on this just because of his time with Johns Hopkins and how a service catalog is going to look different from kind of his perspective lens as both a customer and an implementer.
Yeah, absolutely. I mean, we talked about a few moments ago, the doctors not being technologists and making it easy for our clinicians to find what they need. And both from the perspective of, working at Johns Hopkins, we had to face this issue at Johns Hopkins. And then on the other side of this, as a consultant, I've worked with many organizations in the healthcare world to create a really great service catalog for them. But service catalogs in healthcare tend to be a little bit different. So for one, they tend to be larger. We have for lack of a better term, we have our traditional IT services, the ones that just about any organization would have. But then typically in the healthcare world, we have this whole, if you will, the whole line of services around clinical health or whatever that term is that you want to call it. I'll call it clinical health, but that typically services that support the EHR system, to be honest. So when you think of like the structure of a service catalog for healthcare or a taxonomy for it, we're talking about a lot of things like making sure that we make it very easy for folks to find how do I get access to a particular EHR application or module. So we want to make sure that we have easy to find workflows in place. And as many of the folks on the call know that, you can't always give somebody immediately access to the application, sometimes there are pre-requirements, like they need to have a certain role, they need to have training. So trying to figure out where does our workflow begin and where does it end to end up either provisioning or denying that provisioning for access. We also have to deal with things like incidents, right? When something goes wrong with our EHR system or with one of the applications, how does that get routed? Does that get routed to somebody on a service desk? Does it go to somebody with one of our internal teams, or does that actually go over to the vendor for support? And then, of course, over time, we mentioned, the world will change, demand will change. And how do we support things like enhancement requests? We really want to add a particular feature to an EHR application that we're not really using at the current time. So when you think about some of the struggles, some of the challenges here, keeping the catalog up to date and user friendly is one of the biggest ones. How do we deal with that? So for one, if we're thinking of a lot of our clinicians, we need to make sure that that catalog is accessible from mobile devices, that it's easy to use from mobile devices. And we're probably not going to list all of the items of our service catalog up front. We're going to think about what are the most popular offerings that we have, and we're going to front those. We're going to make those the easiest to find. We see a lot of organizations where the catalog is just too large. And that is very typical in healthcare. So how do we solve that? Well, it's going to be some combination of making sure that we have the right roles, providing role-based access, but then also having some customized views for different folks within our organization. We also deal with situations where some of the services that we have are not exclusive to healthcare and they're not exclusive to IT. So areas like research, reporting, data science, do I centralize all of those in my service catalog, go to one place to get what I need from each of those services, or do I distribute that, in different areas of the service catalog? And then finally, a really big one is if we think of that whole line of clinical IT services or healthcare IT services, how do I actually organize that? And there's no one right answer. I mean, a few of the options are, we can do it by medical specialty, cardiology, radiology, oncology, et cetera. We can do it by the modules of your EHR platform, and here I have some examples from Epic, Willow, Beacon, Haiku, or we can take a different approach and do it from some higher level of abstraction. Like I want to have services around scheduling, training, inpatient services, outpatient services, et cetera. And the answer to how we do that is really going to be dependent on your own organization. So tailoring that to your own organization. But good practice here is really trying to figure out, start with items that are really orderable. Start with the things that people really want to have. I want to have access. I need a particular device. I need to report some trouble with something. So the service catalog is a big key to making things user-friendly and improving both the patient experience and, frankly, your internal customer experience. But the other really big hot topic is on asset management. And I know, Joe, you've dealt with this one a lot as well.
Yeah, I absolutely have. I worked with companies in the past to track how many IV pumps were available in a unit, or does the exam room have the appropriate equipment ready? I also worked on a mobile app that would allow a technician to work offline in the dead zone of a facility doing inventory hard counts. That would then sync back to the platform once connectivity was reestablished. My work expanded to enabling scheduling of maintenance on large equipment like MRI machines and X-rays to ensure that equipment was operating within set parameters, perhaps meeting compliance from the FDA or EPA. All of this was all built on the ServiceNow platform. And using ServiceNow's EAM capabilities, customers can expand their use of the platform to track the asset lifecycle. It's not just servers, laptops, and docking stations, but it's much more expansive than that, extending to assets residing within the clinical or lab environment. And this is way more than replacing the spreadsheet that tracks what gear is issued to which unit, but it's a holistic approach to the full asset lifecycle. Inventory, of course, is the start, but it also has processes and automation for procurement, onboarding, deploying assets in the field. The platform has capabilities for handling servicing of a device as well as decommissioning, and that's not only limited to on-prem equipment, but also equipment that is used remotely in telehealth or visiting nurse services and beyond.
And if you just think of one specific example of that, Joe, again, I was talking to a buddy at a hospital in the area, and he said that right now they're having difficulty finding the wheelchairs. And it sounds really simple. From outside of healthcare, you would say, well, who cares? But you care a lot if you're a patient that needs a wheelchair and you're at the point where you're about to get discharged from the hospital, but you need to get out to the street somehow, get out to the car, and there's no wheelchair available. You might be waiting hours and hours because we can't track down something like a wheelchair. Not to mention, sometimes they walk out the door occasionally. They're not inexpensive devices, but we're talking about, not just an inventory here. We're talking about something that could actually completely change the patient experience and help us to manage, other aspects of the business like cost and risk.
Yeah, you're right, David. And having a platform that can provide these capabilities for EAM has a lot of benefits. Improving the patient experience, like you mentioned, by having a clear view into knowing where that durable medical equipment resides and ensuring it's in the right place when you need it. Patients getting discharged. The platform can also aggregate metrics behind how your deployed assets are performing. You can identify equipment affected by recalls or providing a portal for your staff to report issues with equipment. You can also use these metrics to enhance operations by identifying trends, removing service bottlenecks, and aid in reducing total cost of ownership. You're able to establish routine maintenance schedules, create work orders, or track vendor contracts if your equipment is managed by a third-party provider.
And when you think about this, the benefits aren't just for IT. I mean, I think that's an important point to drive home, that we're talking about improving the things that matter to the hospital or the healthcare organization as a whole. I mean, when you think about that area, that aspect of, burnout and frustration, right? Well, there's a lot that goes into that, right? Now, not having enough staff, having a pandemic, et cetera. But one of the big drivers of employee and workforce experience is having systems and tools that help us to do our job instead of bureaucracy that gets in the way. So, implementing this is going to make that better. When you think about the patient experience, having that wheelchair available when you need it, or having that iPad or that tablet available when you want to check somebody in when you need it, that's going to help to improve the patient experience. And really, who doesn't care about cost, right? So even if you're not in finance, you have to worry about controlling costs and even cost reduction. And being able to better track your equipment is going to help us to do better planning. How much do we need of fill in the blank equipment and when, and help us to identify some trends, help us to make sure that we know what we have and that we don't overspend on things. So this is probably going to be a longer term solution, but controlling cost over the long term. And in addition to the service catalog that we talked about and medical equipment management, ServiceNow also has other healthcare and life sciences applications that could help us out here.
Thanks, David. So let's spend a minute or two talking about those, because these are great products, and it's kind of cool to talk about using ServiceNow for something that is kind of in a very new way. And I say it's in a very new way because sometimes when you talk to people and you mention that you work with ServiceNow, they think, oh, you're in IT. That's kind of almost always the reaction I get when I tell people like I work with ServiceNow, and they're like, oh, what part of IT do you work in? And they're like, it's changing that perception too, of that it's not just IT. When we talk about applications, I am really looking forward to seeing some more information about and working with kind of like this patient 360 application, seeing kind of a full view of a patient or a member in one place. And I'm going to pull out my little laser pointer here because, again, I mentioned kind of data being my theme for the day. Here it is again, where we talk about just the fact that, wanting to be able to see everything that's happening with a singular patient, just the amount of data and amount of systems we're going to have to pull in and talk to be able to do that, but then combining their service management activities within ServiceNow, that system of engagement, is going to be just kind of an amazing benefit of, like, they're hitting chat, they're hitting virtual agent, they're not able to schedule an appointment. Maybe the clinician can look at it and be proactive and schedule an appointment for them or reach out and maybe avoid some of that frustration and or concern. The consent management is also really neat as far as being able to effectively kind of manage that patient and member consent, the organizations that I've worked with in the past, this has been kind of spread across paper forms. It's been spread across some digital forms in some of the EHRs. It's also sometimes in a mobile app, but centralizing all of that within one place, and also having kind of that audit logs to maintain compliance on that. ServiceNow has done this for human resources in the past, but also starting to look at kind of like being that system of engagement layer for digital documentation, because we know that records is in the name of EHR, right? But to be able to facilitate getting things done in the system of record, ServiceNow may not necessarily store the data that it captures and manages through that digital documentation, but it may facilitate that workflow and that process of getting that documentation put into place. And I said I was going to bring it up, and we're going to bring it up again. So there is the specific healthcare data model. So there is a lot of that supporting data that needs to be either entered in ServiceNow or accessible to ServiceNow through API calls. But one of the most amazing things that I'm looking at, and one of the things that I'm currently doing an IT implementation right now. And within an IT implementation, we're leveraging the pre-built integrations for significantly accelerated integrations for the organization. So having this available on the healthcare side is going to be amazing. When we talk about what actually is in the HCLS model, we've got just a couple of large domain areas, and one of the large domain areas is going to be that foundational area where we're looking at like healthcare organizations, healthcare locations, healthcare code sets, practitioner-specific data, a lot of patient-specific data that is optional within ServiceNow to be able to look at like household members, look at appointments. And again, ServiceNow may not necessarily be the system of record for this data, but it may be pulling that data in. Clinical data around the clinical population, and there's a lot of there's other applications within this suite to be able to track like immunization, vaccine products, medications, and then looking at on the healthcare and insurance side, looking at maybe like the healthcare insurance payer or member plan. So being able to potentially effectively intake a lot of that on potentially the ServiceNow side and facilitate getting that information into an EHR system or financial system or system where that data is needed. So we've talked a lot about how you could potentially use ServiceNow with the HCLS to be able to transform an organization. But a lot of that change comes with risk. So I'm going to turn it over to David to talk about how we reduce that risk and kind of change fatigue that people might feel within their organizations.
Yeah, I mean, implementing ServiceNow is certainly about technology. The technology has to work, but it's also, and I would argue even bigger than the technology, it's about changing the way people work, changing our organization entirely. So what really separates, in my mind, a ServiceNow implementer from a ServiceNow partner is organizational change management. An implementer knows the technology, but a partner really understands how to manage the people side of the change. And that's what OCM, or organizational change management, is all about. It's about understanding the attitudes that folks within the organization have towards implementing something new. It's about trying to get people to change the way they behave in response to the technology that we're implementing. And it's also about our culture, understanding the culture that we have right now. Are we going to have a culture that is supportive of the change, or are we going to have a lot of resistance? And I don't know about you, but if it's anything like, the environment I came from, Johns Hopkins was certainly a great place to work, but a lot of health organizations tend to encounter some resistance, right? Because we are risk averse, I hope, because we want to keep patients alive and keep patients healthy, but that also has a downside. And the downside is that it can make it more difficult to implement new technologies and new ways of working. So if you look at something like this, this is an example of the SATIR change model. And we would imagine that, right now we have the status quo. You've heard that expression, the devil that we know is better than the devil that we don't know, right? So a lot of people, even if they don't like the way we're working right now, they're afraid to change. So a really good partner is going to help you to be able to identify where that resistance is coming from. So to assume that there's going to be some resistance, to identify where that's coming from, and then to do things like having communications plans, having crafted messages, meeting with certain stakeholders to make sure we can overcome that resistance, identifying the folks that are champions, not just at the high level, but at the supporting levels of the organization, people who are going to move us to the next place. We have to anticipate chaos, right? Typically, before things get better, they often get worse because we don't know how to work in the new way. So instead of being afraid of this, acknowledging it up front and then preparing for it, getting people through that chaos, then to the point where we start to use ServiceNow, we start to not only implement it, but we really start to integrate it with other tools, integrate it with our processes and the way we work, and really start to adopt the tool. And then ultimately we get to the point, hopefully, of a new change, a new status quo, some change. So now ServiceNow implementing it in this context is not just the new thing to do. This is just the way we work. So it's really kind of, living and breathing this new way of working. And this looks really easy on the chart, but in the real world, of course, this is super, super hard to do. You need to have somebody who really understands this aspect and then has ways of dealing with each stage of the organizational change model here. And beyond OCM, if we just take a step back and really broaden the conversation here, this really leads to what are we doing in IT? If I'm the CIO and I want to change the mindset that IT is the order taker, can I have fries with that, right? If I want to change that mindset to IT is really a driver of the organization, I can't just focus on operational and tactical things. I really need to be accomplishing the strategic needs of the larger organization. So if you look over here at the right-hand side, that where we see ServiceNow strategic initiatives, frictionless customer and patient experience, running IT at the speed of healthcare, operational excellence, which would include, getting things done faster, but also things like controlling cost and minimizing waste. And then always making sure that we're in compliance with rules and regulations and applicable laws and even our own policies. If you look at those four things, I'm willing to bet that if you looked at not just IT, but your larger organizational strategies, you're probably going to find some paraphrasing or some rewording of strategies that look like this. So if I'm the CIO, I want to accomplish these strategies, and I want to do it through IT. I want to do it through implementing ServiceNow so I can actually change the patient experience, control overall organizational cost, make sure that as healthcare evolves, that IT is evolving right there with it. And in fact, not just evolving with it, actually driving the strategy of the organization. This is not easy, but this is the kind of thing that we're talking about with starting with the end in mind. And if I'm the CIO, I want to be right there in the boardroom helping to make these decisions. And so, with that, we acknowledge that you may have a lot of questions about this. We'd like to take a few minutes to answer some of those questions.
Great. Thanks, guys. I'm going to step back in here. If you guys have any questions, feel free to use either the chat panel or the Q&A panel. We've got a couple that have come in so far, and we'll see if we've got some time to tackle them all. While you're thinking of your questions, I would like to do some marketing at you, please. You can see on this slide that we have a lot of resources available to you. If you want to dig further into the OCM model that David was just speaking about, we've got a lot of content on our blog that covers OCM. We also have some recorded webinars that you can find on our site, some of which incorporate OCM. We've got a ton of ServiceNow webinar recordings on there that are all available to you as well. One last thing to mention is the guides, templates, and white papers on the upper left there. We have a lot of downloads on our resources page that can help you solve lots of problems. So thanks again to everybody for being here. Let's jump into our first question. We've got from Douglas. Do you think companies are more likely to take an out-of-the-box approach today versus a year or so ago? Have it.
I'll go on and take that one, Lindsay. So that's a good question, Douglas. I would like to think yes. I from my experience, it's kind of still been a 50-50 split. And I think a lot of that comes back to very much what David was saying, like partner versus implementer, right? Implementers may be not pushing for out of box as much, but those that are looking to kind of partner and build that relationship with that healthcare organization, that's an immediate guidance for me of like, you really do need to be thinking about out of box for long-term health, for platform success, and also for, for ROI. So I think the answer is yes, but it can always be better.
Yeah, I see more implementations going toward out of the box. One, for time to value, and two, David spoke about the financial challenges in the healthcare space and trying to find ways to be cost conscious. And that can be taking a prescribed deliverable of an implementation versus trying to adapt it to your old way of doing things. Let's adopt what's being prescribed by ServiceNow. That not only gets us time to value that's decreased, but also it's more cost conscious as well.
I mean, my experience is that it's really tempting with something like ServiceNow to customize it, because you can. Like, if the answer is can ServiceNow do it, the question is, if can ServiceNow do it, the answer is probably yes. But I would also say, like, quell the temptation a bit, right? Because anytime you ultra customize something, then when you have to change, it becomes more difficult. Just simply from the point of view of just knowing where you were and what needs to change. So I think you'll find that you'll probably customize a little. I shouldn't say customize. You'll configure to tailor to your own environment. But I would avoid like kind of wacky customizations that give you the perfect experience today, but 6 months from now might be a really bad idea.
And that's a tangible example, David. Like when you talk about the client that I had that was taking, quite a while to do their upgrades, that's a tangible cost, whether it's internal cost or whether you have a partner that comes in and helps you with your upgrades. If you're keeping pace with ServiceNow and upgrading, every 6 to 8 months, and it's taking you 2 to 3 months, that's a significant cost every 6 to 8 months to incur, when if you are following those good practices, following those guidance, using that automated testing, those kinds of things, those upgrades are going to be seamless and transparent to the end users, and also at a much lower cost to the organization, again, whether it's internal, whether it's consultative fees.
Great, thanks guys. I've got a question, not to throw you, David, but I did have a question around the OCM stuff. Just having had my head in that fairly recently, I wonder if you could speak to the importance of getting that piece, that component involved in the project from the beginning. I think a lot of times people save that until after go live, and then it's a scramble to try to get people on board. Do you have any advice on that?
Yeah, absolutely. I mean, a lot of times organizations see OCM as an extra, right? Well, one, they might not think about it at all. Honestly, do a more formalized, or I should say a more thoughtful approach to it, not necessarily formalized, but thoughtful. And when you don't do it, right, you miss a lot of things. Like, you might say, well, sure, there's going to be resistance, but people just have to do it anyway. Well, that's probably not the best approach. It's probably better to really think about what we're going to do, identifying those key stakeholders. And I don't just mean the high-level sponsors. I mean, who are the clinicians and the people who are going to use this on a day in and day out basis, and involve them. It doesn't mean they get to make every decision, but we need to know what is going to work for them and what they're absolutely not going to go for. And then that involves typically things like, making sure that we have tailored communications, that we have a plan in place and we have tailored communications, getting people involved at the right time, making sure that when we provide any sort of training associated with it, that training is coming at the right time. I mean, these are areas that, they might seem a little bit, high level and squishy in the beginning, but if you're not addressing those up front, really dealing with this from the beginning to the end of the engagement, and even beyond implementing ServiceNow for this, I think what you end up doing is you end up doing a lot of rework. You end up making a lot of people angry, and you make it a lot harder for people to implement. So essentially, to my mind, not only are you improving the satisfaction of your, in particular of your internal employees, but you're also probably shortening the true adoption timeline, because people are much more willing to work with you when you've addressed them up front. So
Awesome.
I
Thank you
don't
so
really
much.
see it as an extra.
Thanks,
Thank
David. I didn't warn you that that was coming, but I believe in you. Cool. So we've got a couple more minutes. Let's see if we can squeeze one more question in here. I'm just going to read this one verbatim. You presented a sample roadmap of how you might implement different components, but how much variation do you see in how people tackle or go about implementing and adopting ServiceNow?
That's a good question. So I'm going to start, and then I'll probably have Joe chime in. I'm gonna answer that initially with the consultant's answer of it depends, which I don't necessarily like. And the reason I say it depends is because it kind of depends on what the end goal of the organization is, because it also depends on what systems we're integrating with. But at a high level, I think that's also something that kind of happens as a conversation with a partner around what is the end goal that you're looking for? How can we get there? Maybe for example, a customer already has an IT or they already have a human resources ServiceNow environment. Do we need to fold that in? Does that need to be part of the project plan? So I think I don't know that I have a great answer for that other than it is fairly typical from what Joe and I have seen, but it isn't necessarily 100% representative because your partner should be working with you to identify what needs you have and making sure that the implementation meets those needs and meets the outcomes that you set for that implementation. So I'll turn it over to Joe after a little bit of rambling.
Yeah, what I'll say to that is a roadmap isn't a one and done exercise. It's the action of getting together to establish that roadmap. Like, we understand priorities shift, things change. It's coming back and saying, okay, given what we're up against, how do we make this fit, or how do we accelerate this or delay that, and coming back together to make sure that you do still have a cohesive strategy for continued growth on the platform.
And
Yeah.
follow-up point with that real quick, David, sorry. Like Joe had mentioned, the roadmaps are a living document because maybe there's a shift in regulations that necessitates a shift within the project, because that's probably happened to everybody at least once, where there's been a change in regulations, there's been a change in the environment, a change in the market, something, right, that immediately changes the course of the implementation, just to shift based on needs. Sorry, David, go on ahead.
Oh no, I was just going to say that I was lucky enough to be one of the authors of the Digital and IT Strategy publication in ITIL, and some of our conversations early on with some of really the leading service management and strategy experts, I would say, in the world. Some of those conversations were revolved around strategy, and as soon as you put the strategy down on the paper, guess what? Like, you're already starting to veer off of it, and that's not something to be afraid of. Like, that's something you should anticipate. So it still makes sense to have a roadmap, but then to say, okay, pretty frequently coming back to it and saying, we're not going to change our approach every day of the week, but is this still the right strategy to have? Is this still the right roadmap to help us achieve that strategy? So I don't think that's anything new, but I think it needs to be acknowledged instead of just a plan that sits on the shelf and gets dusty.
Great. Thank you, guys. We are at the hour, so it's time to wrap it up. We do have one other question that came through that we would love to address offline since we ran out of time. It was submitted anonymously. So if that was you, let us know and we will reach out to you after the session to make sure we get an answer to your questions. So thank you, everybody, for your time today. Thank you, gentlemen, for the lovely presentation. I certainly learned a lot. Have a lovely rest of the week, everybody.
Thanks, everybody.